Now, we recognize that health insurance is one important aspect of starting and running a business. To this end, we are proud that an idea we had back in 2015, POWERUP DC, has become an important annual event. Our goal then, and remains today, is to help empower small businesses and entrepreneurs to grow and flourish. Now, back then, we put together a brain trust, meaning experts on the ground to drive the agenda to ensure that POWERUP DC provides businesses and entrepreneurs useful and actionable information. So on behalf of our executive board and our entire team at DC HealthLink, I would like to first thank Linda Wharton-Boyd for her leadership. And as someone rightfully said, Linda is a force of nature. She can develop, lead, and execute a successful event, whether it's in person or virtual. A special thank you to Jason Sparks and our incredible IT team. And I also would like to thank Angela Franco, our senior advisor. Today is Angela's last day with HBX, and I wish her great success in her next endeavor as interim CEO of the DC Chamber of Commerce. Now, I would like to thank our POWERUP DC partners, also known as the Brain Trust, the DC Chamber of Commerce, the Greater Washington Hispanic Chamber of Commerce, and the Restaurant Association Metropolitan Washington. Our media partners, the Washington Informer and the Washington Business Journal, the DC Small Business Development Center Network at Howard University, DC Main Streets Program, DC Women's Business Center, and many other DC community partners, the U.S. Small Business Administration, and the U.S. Women's Chamber of Commerce, just to mention a few. A big thank you to Mayor Bowser and her team and many district agencies taking part in POWERUP DC 2020. Now, we've had to close registration for this event once we reached more than 400 registrants, but we will record it and make this available on our websites. Now, I would like to introduce to you a very special guest, John Filchickio, the interim deputy mayor for planning and economic development. On July 2nd, 2019, Mayor Bowser announced John's appointment as the interim deputy mayor for planning and economic development. John has served as the mayor's chief of staff since the start of her administration. He previously served as a senior vice president of DKC, a New York-based public relations firm, as a regional political director for the Democratic National Committee during the re-election of President Obama, and as a longtime aide to former Mayor Adrian Fenty. For John's full bio, please visit dchealthlink.com/PowerUpDC2020. John, it's yours.
Great, Mila. Thanks so much for that introduction and for convening us all today. I wanted to just thank you for having this event because the pandemic has showed us just how important your work is each and every day. So I want to thank you and the team at the DC HealthLink for all that you do, not just today, but every day. And I see so many friendly faces, familiar faces on the line. Everybody is coming to us from different places, but it is a chance for us to come together and focus on the important issue of making sure that our residents and our workers have health coverage. And the pandemic has shown us just how important that is. So I wanted to talk to you a little bit about where we are today. I'm just reminded that today is June 30th, and I got to tell you that June 2020 has been a heck of a year in and of itself. It feels like it's been so much with our work on whether it's the pandemic, the recovery efforts that are underway, the budget process that's also underway, and then, of course, the demonstrations, which we have witnessed and also participated in as a government, and want to make sure that we just thank everybody for bearing with us with so much going on. But today I wanted to focus a little bit about where we are with the pandemic, particularly where we are with phase 2, which we started on Monday the 22nd. And so just to give you a sense of what phase 2 looks like, I know a lot of people on this convening have been participating in one way or another. And so you might know already that stores and restaurants are allowed to operate indoors during this phase. Gyms, tanning salons, tattoo parlors can reopen as long as they adhere to social distancing measures and infection control measures as well. Playgrounds and libraries are open. Houses of worship are allowed to have up to 100 people and operate at 50% of capacity, whichever is less. And so we've listed all the details about phase 2 on our website, coronavirus.dc.gov/phase2, 2 spelled out. So again, coronavirus.dc.gov/phase2. In addition to that, we've also worked with our partners at the bids and main streets in order to have a startup supply of PPE and disinfectant for our small businesses. So that was something that we launched in May, late May, in order to get ready for phase 1. And we look to continue that while we still have the supplies. The mayor has been really focused on making sure that we build up our local supply of face masks, of disinfectants, of cleaning supplies as well, and hand sanitizer, of course, to make sure that we have enough for our health workers, that we have enough to operate the government, and then enough to support small businesses when we can. And so we want to look to keep that up. And so I know there's going to be a lot of challenges that we have ahead, but what we're really impressed by is the resilience of our small businesses. They're the backbone of the District of Columbia. I see my colleague and friend, Keith Sellers, on, who will tell you that we've spent many years trying to attract all the businesses and private employers that we have in the district. That effort has been really kind of shaken a bit by this pandemic, but we're in addition to being the District of Champions, we're going to show everybody that we're the District of Comebacks. And so that comeback is collective, but it also is for each and every one of the people on this call. I know that we'll come back better because of our resilience, and our fundamentals are strong, and we know that we'll be able to be better situated than most jurisdictions in the country to really be ready for that. But we're not out of the woods yet. We see in other places that the pandemic is not eradicated. We flatten the curve, but it's still with us. And so really we just ask that you all continue to be good stewards of the public, whether that's your workers, whether that's your customers, whether that is just the residents that you live next to. And the way you can do that is just following those simple tips. Today, the mayor is going to have a press conference to talk about how wearing a mask and washing your hands are still the fundamentals of keeping us all safe. So let's make sure we do that. And then on the business side, we'll be having a town hall today at 4 p.m. In order to talk a little bit about our shared work program that the Department of Employment Services runs, as well as 2 programs that are 2 initiatives that are going to be taking effect tomorrow. One is the increase in the minimum wage to $15 an hour, something that we set out on the path a couple of years ago. Tomorrow is when we'll achieve it. And then also paid family leave is another element that we'll be talking about on our 4 p.m. Town hall. So look for that. Mila, I just want to thank you again for all the work. Thank you to the DC Health Exchange and all the partners on the call for sticking with us. As the mayor says, we're all in this together and we'll all get through it together. So Mila, thanks again for your time today, and thanks for having me.
Thank you so much, John. And I think you made some news with a preview of what the mayor's going to discuss at her press event. So thank you for making news this morning with us. Appreciate that.
Absolutely. Thanks so much for having me.
Thank you. So in the interest of time, I will introduce the next two speakers now, and I won't say too much about them, so I encourage you to go to our website, dchealthlink.com/PowerUpDC2020 to read their full bios. First, you'll hear from Antonio Doss, who is the district director of the U.S. Small Business Administration. And then you'll briefly hear from AJ Maiden, who is the current chair of the board of directors of the DC Chamber of Commerce and principal and the chief operating officer of OST. Director Doss.
Well, Mila, good morning, and good morning to everyone. It's so great to be a part of this again. The Small Business Administration has been a regular participant in the DC Health Link and the PowerUp conference each of the years. So we have a new twist this year. We're doing virtual. So we will learn as we all are learning about how do we modify what we've typically done and use a different approach. So this is it's a great example that the DC Health Exchange is leading in terms of making sure that this particular program goes on. One of the things that I think really jumped out at me through this whole COVID-19 environment, it deals with the level of collaboration and cooperation that has existed by any and everybody who's a part of trying to help small businesses be successful. And we've seen it at the federal level with the executive branch and the legislative branch, crafting tools and resources like the Paycheck Protection Program and others to really help the small business community. We've seen through our own work and our own involvement with the Chambers of Commerce, with the county, state, district government leadership, with our economic development partners, just everywhere we've walked in this process, we've had great collaborative and cooperation to really demonstrate that everybody who is there to help support small businesses, we're singularly focused on how do we help small businesses. So that's been really, really a great thing. And I think that's one of the landmark items that'll come out of the COVID-19 is this heightened level of collaboration that we can all share. A couple of quick things. One, on the Paycheck Protection Program, we've had some very, very outstanding results with the District of Columbia. We've provided over $2.1 billion in that program already. And the key thing I want to make sure everybody knows is today is literally the last day to access those funds. So if you have not already got your loan application in, you're on really, really thin ice to be able to get it into a lender and get them to get it approved and issued by SBA by close of business today. So I will leave that as my opening remarks, sticking with the time. And thank you again for having me participate.
Thank you. Very nice to see you from afar, Director Doss, and I look forward to next year when hopefully we can do this in person again. Our next brief speaker is AJ Maiden from the DC Chamber of Commerce.
Thank you, Mila. Good morning, everybody. I'm Ajay Madan, Chair of the DC Chamber of Commerce. Mila and Linda, thank you for your invitation this morning. If there's a time that people particularly need access to good health insurance, it's during a global pandemic. In the US, almost 40 million people have lost their jobs. Many of them have been associated with small businesses. And that population is almost 30 million who've lost health insurance. The good news is that we can get health insurance through exchanges under the Affordable Care Act. The DC Chamber of Commerce has been a proud partner of the DC Health Link since the inception of ACA. And we've worked together and collaboratively, just like Antonio was talking about, to promote and ensure businesses are enrolled in quality, affordable health insurance. The Chamber and the business community at large have really commended DC Health Link for the steps it's taken to support businesses during the pandemic. It has not been easy. If you go to the DC Health Link website, you'll even notice that there is a link where you can click to get information on how HealthLink is providing COVID support. the first thing you'll see on that link is a quotation. "We are here for you so you can get the care you need." And this is the type of dedication and focus that HealthLink provides to businesses in need. Today's Power Up DC is yet another example of how HealthLink is showing us embrace and support of the local business community. We at the Chamber look forward to our continued participation. Mila and Linda, we really want to thank you. We know that as we come back, as John was talking about, HealthLink will continue to provide a competitive edge in recruiting and retaining a quality workforce so that those small businesses can get back to where they were. Thank you for your invitation and your time this morning.
Thank you so much for your partnership over these years. Now, it is my privilege to introduce to you our next speaker, Rosie Allen Herring, President and Chief Executive Officer of the United Way of the National Capital Area. Ms. Allen Herring is a national expert on public-private partnerships, philanthropy, and business strategy. She currently serves as the President and Chief Executive Officer of the United Way of the National Capital Area. She's recognized as a thought leader who demonstrates the ability to convene public-private entities, to leverage talent and resources, and create collective impact in communities across the region and beyond. She has more than 25 years of experience in the area of corporate finance, strategic leadership, public and private partnerships, corporate philanthropy, and community investment. Without further ado, please, Rosie, the mic is yours.
Thank you so much, Mila, and thank you so much to Linda Warden Board. You, Mila, and Linda, and coupled with Angela Franco, I think you all are a trifecta for this region. And so thank you to everyone who has chosen to give their time today. I will be before you very briefly, and it really is to just share where we have great opportunity in terms of being able to look at not only this new era. I love the title, New Era, Resilience and Opportunity, because for every challenge there is an opportunity. And I think that you have, in the panelists that you're going to hear from today, I really employ all of your visitors and all of the attendees to take advantage of this moment and bring your voice to this work as well, because there are multiple perspectives. And I also want you to understand that the economy is contingent on all of our voices being at the collective table. And so as I think about where we are, I think there's no secret to anyone that we are in unprecedented times. We are in a historic time. And this is an opportunity for us to think about not only all of the challenges that are there. The challenges, of course, have ranged from health, from seeing our neighbors, get sick, some pass away. We're looking at our frontline workers who are doing their best to be able to serve those who are in need, to looking at education, non-traditional in terms of when we think about business, but thinking about how we're educating our children. And let's think about what the effect will be for them. One of the things that I know we don't talk about very much is, in terms of health, trauma-informed care. This has been a significant episode for everyone. The pandemic has spared no one, whether you've been directly impacted by it or indirectly impacted by it. Everyone has been impacted by it. And so as we think about health in the future, let's make certain that we take into account trauma-informed care will be a lot of the mental services that we need. And when we think about our children, by the time they get back into the classroom with formalized instruction, it could be anywhere from 6 to 9 months that they've been without that formal instruction. And I don't know about you, but if you have small children, and we all know that they tend to lose and have that brain drain during the summer, certainly now with them having been out of the classroom, we have a significant challenge ahead of us. And finally, let's look at the economic impact of this. As Linda and I were talking about, thinking about all of the efforts that are there and all of the needs that are there, for many of you as small business owners, you are the engine that ensures that our economies keep going. And as a recovering economist, I totally understand all of the demographics and all of the data points that help us understand where we need to go. So as we think about our gross domestic product, as we think about all of the economic indicators that tell us that we're doing well or not, as we think about many of our small business owners being the engines for our communities when it comes to workplace and thinking about all of their employees, whether they can bring them back or not, whether or not they can continue to survive or not. Think about all of the resources that are available to us and whether or not we can take advantage of them. I want to just acknowledge Director Doss and what they're doing at the SBA, especially when it came to the Paycheck Protection Program. We know that in the first iteration of it, there were challenges, and that many of our small businesses did not think that they could take advantage of it and probably could not based on the criteria that was set forth. But the ability to come back and revise and renew says that then at least they listened, and that there was an opportunity for many of our small businesses who do most of our hiring and where most of our employees basically work, had that opportunity to do so. So as I think about where we are in terms of powering up, I'll leave you with a couple of analogies. It's time to reset. We have to think about not getting back to pre-COVID normal. I don't believe that that's possible. We have to get to a better normal. And what that looks like is dependent on how we retool and reshape now. We have to get to recovery. This is something that will be with us for quite some time. I think that we have to look at all of the indicators that say this is not going to be a flip a switch and we all go back to where we were before. Recovery, I believe, is in the works for the next 18 to 24 months before we see some semblance of perhaps what we consider to be a better normal. We have to think about all of the opportunities that we have in terms of what we need to look at in terms of our business models. I encourage you to think about meeting a need. Look at the opportunity that's out there. Do something perhaps differently than you had expected to do, and think about your own business model in terms of overhead and cost. I think if anything, and it's caused us to do the same at United Way, we've been able to think about not having as much physical space because we've been able to do so much work remotely. Do we need those kinds of capital costs and overhead costs in order to be able to have an effective bottom line? So I want you to think through what that looks like. Come up with innovative partnerships. Look for some new partners that perhaps traditionally you may not have worked with and maybe didn't see the connection. I will tell you, while we're your United Way and we're here to fight for the health, education, and economic stability of our entire community, we found ourselves doing some different things as well. Who knew? I've become an expert in understanding what N95 masks are and being able to get to them and be able to get them to where they needed to be. Being able to coordinate, food and meals to those who are hard hit by the pandemic, be it elderly or those with health challenges, or certainly young kids who, their meals in school was the only one that they were getting. It's caused us to look at our business model as well to ensure that we're able to pivot with the times, and I encourage you to do so as well. We also have to recalibrate. What is our new quote unquote normal, and what does success look like for us? And finally, let's get into rebuilding and reconstructing what we thought we knew versus what we have to do. And I can guarantee you, we will indeed get through this. We will get through this together. We will have a better normal, and we will continue to lead this country as the most significant region in this country in being able to bring all of our people back to work, but also build a better thriving community. So I thank you for being here today. I look forward to hearing from you, and continue to let us know as your United Way what we could or should be doing with partnership with you, as well as for you as our neighbors. Thank you again, Director Kaufman. Thank you again, Ms. Warden Board, and thank you again to everyone who's chosen to give their time today. We are in a new era. The resilience will bring us to those new opportunities. Thank you so much. I yield back to you.
Thank you so much. I have to say it's quite an adjustment not to clap. So I'll do that because I haven't adjusted. Thank you for those, for the challenging words and the words of inspiration and motivation. Very much appreciate your participation in today's event. We will now go into our breakout sessions, and there are 3 of them. And I understand that you'll automatically be placed in the one that you're speaking at or you've selected, or you can choose to hit a button to transition to that breakout session. So Have fun in your breakout sessions, and I will see all of you after the breakout sessions.